Coming to you live for Thursday Thoughts, where we discuss topics in plastic surgery. Again, my name is Dr. Garrett Wegerif. I'm here at Pure Plastic Surgery in Miami, Florida. You can check us out online at pureplasticsurgery.com. I am a double board certified plastic and reconstructive surgeon, and today we are going to be talking about arm lifts or brachioplasties. I don't think we've talked about this in a while, and we have a good case here to kind of demonstrate the power of what this procedure can do for people. Arms are always kind of a challenging subject for patients to get behind. We understand, it's a long scar that can be pretty visible. A lot of the surgeries we do, we're able to hide the scars really well. For breast surgery, it's underneath the bra or hidden in the fold of the breast or around the areola. For stomachs, it's hidden down in the underwear line. For arms, it's one of those areas where it's hard to get away with completely hiding it. But it's oftentimes our only option to really improve loose skin of the arms. We're going to talk about the surgical brachioplasty today. Later on, we're going to have another conversation about some of the less invasive things we can do for borderline patients that have very minimal loose skin and just have some fullness that want to reduce that with liposuction and modalities like body type. But today we are talking about the surgical brachioplasty. And so this is actually removing the loose skin from your upper arm. And this is especially common in patients that have had weight loss. So, we have different types of arm issues out there that people want to address. Sometimes people have really just full arms before they've lost weight and they want to address that. It's really not a great procedure for that when you have really thick, full arms, because we're not able to tighten them as much as our patients would like. But if you've had weight loss surgery or you've had the new GLP-1 medications and you've lost a significant amount of weight, or just with diet and exercise, it's an area where people actually hold quite a bit of weight, some people, and when they lose that weight, they're left with this loose skin. And how do we address it? We need to surgically remove that skin. Unfortunately, there's nothing you can do in the gym to really get rid of that loose skin, even by building up muscle. The amount of muscle you need to overcome that amount of loose skin, you would need to look like Ronnie Coleman or something in the early 2000s to get away with that. So what we're doing with this, and what I've modified, or what surgeons have modified a little bit somewhat recently, is the exact placement of the scar. Traditionally, a brachioplasty, the scar really came right across the center of your arm, and this was thought to be a good location for it because when people are walking behind you, you can't see it, or when your arms are down by your side, you don't really see that scar from the front or the back. I've shifted my scar a little bit lower, and you can kind of see, I really try to get it to hide down by the lower border of the arm. That way, when you're sitting there talking to someone, you're not gonna fixate on that scar. If it's right in the middle here, you notice it more, and it's something that a person will be talking to you and see it. It is possible you can see this a little bit from the back, but again, I try to hide it so it's really hiding mostly along this inner border. So it's not straight on the back, it's not straight in the front. It's really trying to be in the sweet spot in that lower anterior border of the arm, so that it's not really catching your eye from any direct location. The scars are definitely something we talk about with this procedure because, like different parts of our body, we have our scars are typically very thin, heal very nicely. For abdominoplasty or breast incisions, they usually stay nice and thin. Whenever we're talking about doing surgery on extremities, our extremities are always under motion, and there's a lot more tension on those scars. So those scars always tend to be a little bit wider than we would like to see them, and they can sometimes be a little bit raised too. So it's just something you need to be aware of, and it's part of the trade-off for improving the contour. But you can see how powerful it is for this patient, how much her contour improved. And when she's sitting there talking, she doesn't have the bat wings flapping around anymore. She just has this nice smooth contour of her arm. So again, this is front view, this is a view from the back. Again, you're not seeing any major scar from the back, so it's not something that's super noticeable, but you can see the pink scar that goes along. Where do these scars start and stop? It's typically at the elbow. Sometimes we need to extend it a little bit onto the forearm depending on how much loose skin you have and where it is. Sometimes we even need to extend it down through the armpit. Sometimes for our weight loss patients, we combine this procedure with breast lift or breast reduction, because when somebody loses a lot of weight and their breasts start to droop a lot of that happens in the lateral breast. And so I'll find another good example of one of those procedures where we actually connect this scar. You go all the way from here down to the breast reduction or the breast lift scar to contour that whole upper abdomen to get rid of that looseness that's associated with all these different areas. So it's a really powerful procedure. You just need to understand kind of the trade-offs for it, which is going to be a scar, but it's going to greatly improve the contour of your arms. The other thing you need to be aware of, these, again, because of the motion that we have, these scars tend to sometimes have wound healing issues. I would say about 15% of patients have at least a little area of wound breakdown, most commonly around the armpit area, because that's where the most motion is. And it's not a big deal. It's treated with local wound care. It goes away within a few weeks, but it's something you need to be aware of. And just one of the challenges associated with this procedure. Like all the procedures we do, it's very important to follow post-operative instructions, wear the garments. You'll have wraps on over your arms immediately after surgery, but then you'll be able to switch over to sleeve. It's very common to have a lot of swelling in your hands the first few days after surgery. It's possible to have little tingling from superficial nerves that can be affected with this, but it's usually always temporary. And sometimes I do combine this with some liposuction of the arms to debulk a little bit. But again, if you have really super full arms and you haven't lost that weight yet, and that skin isn't hanging down here, you're not a great candidate for a brachioplasty yet. You really should lose the weight first and come to me with that loose skin, and that's much easier for me to tailor and tighten up. All right, talked a little bit about brachioplasty. What questions do we have out there for us?
Yes, Doc. Let's start with some comments. Had one 14 years ago. I can barely see my scars. I feel like I need another one because more of weight gain and loss. So like a
So,
round two, it's possible?
absolutely, it is possible. And what this patient is saying is very true. Like, this patient's less than a year out, and that scar is a little pink right now. Like all scars, if we give these time to mature, they tend to fade, and especially the pigmentation tends to really blend in. And the things we can do, like silicone strips or silicone products on this scars, will help them from being raised. But that's a great testimony from a patient saying it's not something she notices, but now she's had more fluctuations in her weight, just like all of our weight loss patients that we counsel. It's possible to have areas of skin loosen up again, and that's just kind of the maintenance that we sometimes have to do for these weight loss patients. Same thing with the breast or abdomen. Sometimes we have to tighten things up a little bit, but it's absolutely an option to tighten things up again and get you back to a point where you want to be.
Another question, Doc. I still have swelling in one arm. I'm 4 months post-op. Is this normal?
So it can be normal at this point. The one thing you want to make sure is that you don't have any signs of a blood clot, which is possible. When we tighten everything up, it's decreasing the venous return. One of the things I recommend for people that are having ongoing swelling is to really keep that arm elevated when you're sleeping. So you want to prop it up on multiple pillows so it's up above your heart when you're sleeping at night. That at least gives your body a chance to decrease that swelling overnight. If it builds up again during the day, that's possible. But speak with your surgeon. Sometimes I send people to get ultrasounds to make sure there's no sign of a blood clot or anything like that.
How likely is fibrosis in this type of scars?
So any scar is going to have some degree of fibrosis. I don't think it's not fibrosis like in the same sense that we talk about with liposuction procedures where you get bad contour irregularities. It's just the thickness of the scar. If you're prone to keloiding, it's definitely an area that can keloid, and it's one of the kind of contraindications to doing this procedure because sometimes those keloids can be significant. But if you have no history of keloiding, there's no reason to hold you back from doing that. One thing I will say is sometimes in the armpit, when that scar contracts, we have to do what's called a Z-plasty to lengthen that scar so that it doesn't ever tether your skin for when you reach up. And it is possible after the fact, you could, if that scar tightens up a lot, it could restrict some motion, and sometimes we have to come back and do a secondary procedure again. That's called a Z-plasty to lengthen that scar so you don't have any restriction in the movement of your upper arm.
I want one. I want one so badly, but the scar scares me. I have lost 150 pounds. Does my age affect how my scar will heal?
So age always affects us to some degree because our skin elasticity, the collagen fibers in our skin goes down every decade of life. So the older you are, the less elastic your skin is, and it's more prone to stretching again. But it doesn't mean you're not a candidate for this procedure. And I understand the concerns with the scar. You really just have to be honest with yourself. What would you prefer? Would you prefer the improved contour of your arms or the scar? And most of my patients that I've gone through with this procedure, they're very happy with their decision. They much enjoy the improved contour and the firmness of their arms compared to the loose skin, and they're happy to make that trade-off for a scar.
What do the scars look like when the arms down and from behind? Okay.
Arms down and from behind. I should have shown a picture of that, but again, with my scar
This?
placement, yeah, I mean this, we have another picture up showing the scar from behind, but this is a view, with her arm outstretched. We can find another one with it down. The one area where you sometimes see it is our arms are dynamic, so they never sit in one location. So depending on what angle someone's arm is, you may see a little bit more visibility of the scar, especially when your arm's turned in, it may poke out a little bit more. But when your arm's directly by its side or sticking out, you're not gonna see it at all in the back. Again, I'm trying to make it hide within the inner part, the inner lower part. So, our arms are very dynamic, so it depends on how you're standing, but I do my best to find that position that is going to be the least noticeable from the front and the back.
Great, Doug. Why are the before and after pictures always with the arms up? No one walks around like that.
No one does walk around like that, but this is where you can see the skin laxity the most. So that's why we always do our before and after pictures. And you want to make sure you're getting a nice smooth contour like this. One of the issues with brachioplasty is you can over tighten it in the middle, and you can lead to this little hump in the middle because it's over tightened in the middle versus the two ends. So this is to demonstrate how much skin laxity was there before and how little is there afterwards.
Thank you. That's a helpful way to think about it. That's a message. And just 1 second. Okay, there are 3 questions about pricing and bookings and
Right.
complimentary.
So, please come check us out at pureplasticsurgery.com. And coming up on May 30th, so next Friday, I have a day for free consultations. We do not do this very often, and those final few spots are booking up quickly. So come check us out at pureplasticsurgery.com, and you can book a free consultation. This can be in person or virtual, and we can talk about your surgery.
Okay, and last question, Doug. Is there any way to have this done and not have a huge scar? In which state are you located?
So we're in Miami, Florida. It's not possible to have a brachioplasty without a scar. The only other modification I can say to that is if you just have fullness right up by your armpit, sometimes we can do a crescent lift where we're trying to hide it in the armpit, but this patient would not be a candidate for that because she has laxity that goes all the way out to the end of her arm. If it's really isolated to up here, we can do a crescent lift that hides more in the armpit, but there's only a few patients that are good candidates for that procedure.
So,
We'll come back and talk later about our other options, including liposuction and body tight, but those are for people with almost no skin laxity, just some fullness of their arms that want to decrease that fullness. And so we'll have another Thursday Thoughts about that subject. All right, everybody, thank you for tuning in. Have a great day. Come check us out at pureplasticsurgery.com, and we will see you next week.
thank you, Doug. Bye-bye. Boom.